Sir, you okay?
All right, Jim, so we're heading to the cath lab now.
What's your chest pain at?
Almost there. Hang on there, Dale.
How you breathing, sir? Sir? Sir?
Sir, talk to us. Charge to 360, please.
Clear!
Sir, you doing okay? Yeah. All right, you left us for a second. Let's worry about getting that artery open. Come on, folks.
Good evening and happy Valentine's Day. I'm Bridget Shotted, Chief Operating Officer of Florida Hospital Pepin Heart Institute. Thank you for being here on this very special night. Florida Hospital Pepin Heart has been completely devoted to saving the hearts of Tampa Bay for 25 years. Our dedicated and expertly trained physicians, nurses, and technologists have worked together for decades to create one of the leading cardiovascular programs in our region. Today, Florida Hospital Pepin Heart leads the region in research, prevention, diagnosis, and treatment of cardiovascular disease. Heart disease affects everyone, no matter the age, the gender, or occupation. As you just witnessed, we opened with a cardiac flatline in tonight's video, not only to grab your attention, but to bring home the point that for expert cardiac care, your heart belongs here. Time is muscle. Together, we will win the battle against heart disease. Your friendship and support mean the world to us. And tonight's proceeds will provide funding toward our hybrid operating room. And thank you again for helping us save the hearts of Tampa Bay.
I was a speed skater and I had shattered my ankle back, and that was like 1972. So that was really the only surgery I really had ever had. And I wasn't really sick. I never had a problem. There's no heart problems within my family. My son came home from work and my wife said, "You need to get Dad to the hospital, there's something wrong." And I went into Largo Medical Center and they said, "You're having a massive coronary as we speak."
Kevin's never been sick. There's nobody in the family that had heart attacks. He was only 50.
We looked to see what other options were there, and I became aware of the research program here using stem cell, and thought, let's make the connection. So,
the Athena Trial is really the first trial available in the States where we take fat cells from a liposuction in a patient, isolate those, and then come back the same day with an intramyocardial injection technique and inject those cells directly into the heart of the participant in the trial. So those patients undergo the procedure, they get their own stem cells or a placebo, and then they're followed up with cardiopulmonary testing for the next year.
And if you can give to the program, you know where it's going. I mean, this is like, to me, a second chance.
As soon as I hit the doors here at Pepin Heart Institute, they were ready for me. They knew what was going on. And so then the procedure started, and that was determined that we needed to do open heart surgery.
Well, we see a lot of patients, but there will be always few patients that you will always remember, because I saw Joe Nuccio when he was in his 30s when he had his first heart attack.
Since day one, I've been treated with great care, great respect, from the nurses to the doctors to anyone that I've ever met within the hospital. I feel very comfortable here. Not only that my doctor's on staff here, but even to the point when I first was transferred here. Everybody was just ready.
If you're a patient and you're choosing a hospital, you know, most patients choose hospitals because their doctors tell them to go somewhere. A lot of people, and I'm speaking from personal experience, choose hospitals in the state of Florida based upon outcomes. So I would say if you were going to look at Pepin Heart Institute at Florida Hospital, you ought to look at our outcomes, how well patients do after they have surgery or after they have a percutaneous cardiac procedure, and you would choose us.